If you take benzodiazepines on a daily basis, there's some things to know. First off, you shouldn't be on them daily unless it's absolutely necessary. Because it's not a medication to be used daily. It's a medication to be used as needed. For some reason, doctors started slipping it in as, take this every day to help your sleep, help your anxiety. But it's not made for that. It backfires. It's only made for like emergency situations where you're having a breakdown, or you're having an anxiety attack and you take one, calm down, or if you have a big speech you have to talk in front of people. But the problem is, if you are on them daily and it's helping a condition, that's great. Sometimes they stop working. You have to keep upping your dose, and then you're going to hit a wall at some point. So that's scary. But if you're cool, you're stable, everything's good. What if your doctor retires and the new generation of doctor comes in? They don't prescribe benzos the way that the other doctors do. Doctors don't want to prescribe them, period. So if they get a new patient, they want to pull you off fast. What if you move and you have to get a new doctor somewhere else? A lot of things can happen where you don't have the same doctor. You're not going to be able to get the benzos again. Someone new can pull you off, and then you might run into a problem trying to get off them. I mean, you can definitely get off them safely. Just taper slow. Follow a nice calculated program that's set out in the Maudsley prescribing guidelines or the Ashton manual. There's really great taper schedules there to get off of them. I mean, if you're on them and they work, fine. It's just that there's a possibility that at one point you may have to be forced off them, and that's where I get all the phone calls and get all the emails. People get pulled right off by their doctors, and then they're in a real bad situation, and then the doctor doesn't believe them. They just think they're overly anxious and give them antidepressants, make things worse. There's a lot involved with it, but the first step is, if you're on them daily, just keep that in mind. All right, love you guys. If you need anything, DM me. Taking phone calls if you want to. DM me for info on that. And you have a good day, and I hope you feel great.